COVID cases are on the rise once again in Colorado. This is happening as the stealth Omicron variant has been detected in multiple cities, including Denver. So CBS News Colorado medical editor Dr. Dave Hnida is joining us now. And Dr. Dave, tell us about this new subvariant and how maybe it's different than Omicron.
Well, I think at this point in time, a lot of experts are really worried about what's going to happen with this new variant. We are really thinking that as we get into April, there will be a new wave of illnesses caused by the new variant. Problem is, we don't know whether this is going to be a wave that is like a tsunami, whether it's going to be a little ripple, or whether it's going to be somewhere in between. The bad news about this variant is that it is more contagious than just the Omicron. And so the likelihood of becoming ill is much more higher than it otherwise is, just even with Omicron, which is extremely contagious. The other thing is that when we look at people who are not vaccinated, people who really have not been boosted, they are at risk for having illness from this new variant. And with that illness comes the risk of obviously being, out of commission for a while, even at risk for hospitalization. The good news with this is we do know that people who are vaccinated, especially those who have had their third vaccine, do have good protection against this new variant. And so hopefully everyone will be able to get that third vaccine to be considered fully vaccinated, so you can go on with whatever this new normal is and try to live life in this new normal at this point in time. I think the best thing to say about really this new thing that is coming our way is it's predictable in a way that is totally unpredictable, which is the way it's been throughout this whole pandemic.
Oh, yeah, it has been very unpredictable, kind of just roll with the punches and what we learn. You talked about vaccines, and Pfizer and Moderna are both seeking emergency use authorization from the FDA for another booster shot. Tell us who may need the fourth dose and when they should get it.
Well, I got to tell you, we're talking third and fourth doses right now. The big concern in the medical community remains people who have not gotten the first dose. We are having 30% of Americans who have not been vaccinated, and they think, well, I'll be okay. I haven't gotten it yet, or I've had COVID in the past, so I am protected. The big thing to understand is this virus is constantly mutating. There are new variants coming around all the time. It is a forever virus. And there will be no forever natural immunity. And so big caution there if you've not been vaccinated. And we really strongly recommend, at a time right now where there is a little bit of a lull before cases shoot up, please get your vaccination. Now let's talk about third vaccines. Third vaccines are considered to be the booster and considered to be really necessary as we see something like the Omicron come around, or Omicron part 2, extremely protective. And that really is essentially for all adults. But then we go to the fourth vaccine. The fourth vaccine is just a little bit more, we're unsure in terms of who should be getting this. I think at this point in time, most of the experts are saying, well, really not for younger, healthier people, people with no underlying health problems, but for people who are over age 65, people who are immunocompromised or have other diseases going on. A fourth vaccine or a second booster may be something that is a really good idea. And I will tell you, from a personal basis, I'm immunocompromised. I've already had my fourth vaccine and feel very comfortable with the fact that I have had that fourth vaccine, and feel that it has been very protective in terms of allowing me to be out and about and working and doing the things that I would like to do with, just some additional precautions. One final note on this one, we're talking about, booster shots at this point in time. I have a feeling that as we get to fall, what we are going to see is probably, I don't want to say a totally new vaccine, but almost like flu shot. We're going to see a seasonal change each year, most likely. with a different type of booster with a little bit different ingredient combination for protection. So we'll see as we get through this wave, as we get through the coming months, and then as we hit fall.
Absolutely. And then kind of on the other end of it, Moderna announced the results of its COVID vaccine for kids younger than 6. Tell us what they discovered and how soon we could see a vaccine for young children.
Well, this is really good news for parents. I think it really takes a load off of their mind in terms of no protection without the vaccination. Moderna did put out some new information about their recent studies. And what they found is that the vaccine is in this age group, 6 months basically to 5 years of age, is extremely safe, extremely protective. Now, what they've done with this vaccine is they've basically taken the grown-up dose and they've taken it down to a quarter of a dose. And what you do is you give a quarter of the dose initially, and then the second quarter dose about 28 days later. Now, it has been shown to be effective, and that's obviously extremely important, especially when we worry about COVID in kids, because kids, even though they tend not to get as sick, they do get hospitalized. There has been a big increase in hospitalizations during Omicron, and also the fact that we worry about things like long COVID, and the fact that they are also around, let's say, their grandparents who maybe don't have the immunity that you'd really like to see. In terms of side effects, that is always the big thing. And side effects in this clinical study really were shown to be very, very minimal. About 1 in 6 kids got low-grade fever, low-grade being defined as 100.4, and really not seeing any severe illness with it. And there were no cases of inflammation of the heart, myocarditis or pericarditis, which was the big thing that was the concern when it came to immunizing adolescents against COVID. So I think that this is really good news, and I think a very important piece of news. And I think that what we'll see is this information being presented and analyzed within the next few weeks so that they can get the ball rolling on this.
Absolutely. Well, thank you so much, Dr. Dave, for joining us. It's great to see you again.
Thank you.
Of course. And remember, you can catch all of our Q&A with Dr. Dave segments right now on cbsdenver.com.